dementia.
Greetings, everyone. Thank you for joining. Today is our first timer symposium. This is the first of 3 events that we're planning for our Arizona Alzheimer's State Day, which is in 1 week from today. It seems like it was, in some sense, yesterday where we were all getting to the Capitol and meeting in person. Unfortunately, this year, due to COVID, everything is virtual, but I am excited and happy and welcome all of you to our first event. I would like to go over our program highlights. You will hear from volunteer advocates discussing an overview of the association, our national and state policy priorities, volunteer advocacy roles, our advocacy activities, and intro to storytelling. As we always start meetings in our advocacy world, we are a bipartisan organization. We keep everything purple. With that, I have a quick video that I would like to share with everyone. I'd now like to hand it over to Lauren Blackburn, who is going to be introducing all of our volunteers. For those of you that don't know, Lauren is the Desert Southwest Chapter's Development Assistant, where she works primarily on our events such as Walk to End Alzheimer's, The Longest Day, and Rivals. She brings her background in education and political science and policy to work across pillars with our advocacy initiatives. Lauren, take it away.
Thanks, James. Now I want to introduce Scott Gardner. So Scott has a 28-year relationship with the Alzheimer's Association, where he has served in both volunteer and staff roles. Scott currently serves as a member of the board, the chapter board, and is the co-chair of the Public Policy Committee.
Great, thank you, Lauren. Okay, I'm going to speak to our mission and vision as well as our strategic plan. For a few of you, this will be sort of repetitive if you've been involved with the organization in different ways. But it's really important to familiarize yourself with the vision and mission, because that's the essence of what we do and will always be doing until there's no Alzheimer's. So our vision, of course, is a world without Alzheimer's disease and all other dementia. So as an organization, we not only are fighting for people affected by Alzheimer's, but really all other dementias as well. And then our mission, does this flip to the mission? Yeah, there we go. Thank you. So our mission statement is the Alzheimer's Association leads the way to end Alzheimer's and all other dementia. And we do that by accelerating global research. We are the largest nonprofit funder of Alzheimer's research in the world. We also do that by driving risk reduction down and early detection, of course, which is more important than ever as we are beginning to see the light on some new possible treatments. And also to maximize quality care and support. And we'll be talking a little bit more about that as we get into the actual strategic plan. So through a collaborative organization-wide process, a bold 10-year vision was created back in 2015. So we are right in the middle of that vision, 10-year vision period, which will go through FY 2024. And that vision is for both research and care and support. So let's skip to the goals now. So this slide shows you 7 goals, or our strategic pillars. Operations is something we kind of take for granted. It's just part of what we do to get all of the other work done. But more importantly is to focus in on the other 6 parts, or 6 parts of our strategic plan in our pillars. I want to start with the second one in this slide, and that's care and support. The association works on national and local levels to ensure care and support for all those affected by Alzheimer's and dementia. And I want to underscore the word all others, all those. So it's not just the folks that we are able to reach through our own care and support programs, but we have to affect in a very positive way all of those who are affected by this disease through care and support services. So we do that not only through what we provide, but other programs and collaborative efforts with community partners and others. What we want to do is really increase our reach in care and support, and we can do that through health systems advocacy and care and support offerings, as well as just working with other organizations to improve what they are providing to the Alzheimer's community. One of the key points that we are working on through this 10-year plan, 10-year vision, is really increasing the number of people that get a timely and accurate Alzheimer's or dementia diagnosis. Because then we know that folks can get access to the services, the care they need, the support along the often long road that Alzheimer's affects families as well as the individual. So that's really, really important that folks get a timely diagnosis. Second of all, of course, increasing research. When you talk to anyone in the public and they think about what the Alzheimer's Association does, yes, they think about how the care and support that we provide, but they think about what we're doing to end this disease. And so that's research. We are the largest global funder of Alzheimer's research, other than the United States government and the Chinese government. We are the largest funder of research in the world. And we do that globally. It's not just what we do with our researchers in America and the National Institutes of Health, but also what we do with other countries and other countries' health and dementia programs. So we look at both how we can provide treatment, how we can prevent the disease, and ultimately a cure. The third area that, our third pillar, is increasing concern and awareness. Now, I've been around long enough in these 28 years that I've been involved in the cause to know that we've come a long way. When I first entered the Alzheimer's field, there was very little knowledge or even acceptance that Alzheimer's was even a disease. And today, most in our country will at least recognize what Alzheimer's is. They associate it certainly with an aging population, but more and more people are beginning to understand why this disease is so difficult and why we need to eradicate it because of the increased severity, the increased number of cases, and the cost to our society. So increasing concern about the disease and awareness of the Alzheimer's Association is an important pillar for us. We need to invest in media efforts and outreach. Social media is becoming an increasingly important part of that. And what we all do to spread the word at a grassroots level, those are all important to increase concern and awareness of Alzheimer's, as well as the greater field of dementia. Strengthening diversity and inclusion. That seems to be almost a buzzword in corporate circles today, but it's incredibly important for us, for the cause. Persons of color are often more susceptible to getting Alzheimer's. There's a higher incidence among the African American as well as the Hispanic Latino populations. And so really being inclusive in terms of who we are serving, who we are working with, certainly the LGBTQ population, another important part of diversity and inclusion for our cause and our organization. The reason why we're here today, of course, is public policy, and that's a fifth pillar. And what we do through our own advocacy efforts, as well as through our sister organization, AIM, the Alzheimer's Impact Movement, is critical to getting the right policies in place. And we approach it as the volunteer health organization we are through volunteers. That's why we're all here today. is because the volunteer part of this movement is absolutely critical to getting the needed public policy improvements and changes that we're all looking for. We do that at the federal level, particularly for research, but really for care and support as well. And of course, at the local level, here at the state level, which is what we're dealing with certainly this week, with really reaching out and making sure that our elected officials, that our government officials as well at the state level take on Alzheimer's as an important part of what we need to be doing in Arizona. You're going to hear some statistics later, but it's especially critical in our state that we're paying attention to Alzheimer's disease and dementia and really supporting initiatives to help improve the well-being of the public in our state. And then finally, increasing revenue. As an organization that is very grassroots we were created originally by caregivers and support groups back in 1979, 1980. And we, to this day, the roots of what makes us important and successful in really addressing the mission and all of our strategies is our volunteers. And the way we approach revenue development is very much volunteer focused as well. Think of Walk to End Alzheimer's, think of The Longest Day. Those are entirely revenue generated through people that care about the cause, through volunteers. Other aspects of revenue are important, and of course revenue is the one engine that drives everything we do. Without the money, we can't provide the care and support, we can't do the advocacy programs, we can't be inclusive. So the money is an important driver in all of our strategic pillars. So with that, I'll turn it back to Lauren unless there's some questions, James.
Not seeing any questions, so I'm going to go ahead and go forward. But if anyone has questions at any time, feel free to put them in the chat and then we will get to them. Thank you so much, Scott, for sharing that. Next, we have Janice Dinner to discuss the national, state, and federal policy priorities. Janice Dinner was a senior associate general counsel at Banner Health for 35 years before she recently retired. She is also vice chairman of Jewish Family and Children's Services, immediate past president of the Arizona Healthcare Lawyers Association, and a member of the executive committee and on the board of her synagogue. Janice, I think you might be on mute.
You are right, and I've been talking away. Thank you, Lauren, for that kind introduction. Let me first talk about the federal priorities. There are 3 of them. Increased investment in dementia research at the National Institute of Health. Currently, there are no medical treatments that delay or stop Alzheimer's. Thanks to advocates like yourself, efforts to increase Alzheimer's and dementia research funding at NIH has resulted in a 7-fold increase since the passage of the National Alzheimer's Project in 2011. Funding for Alzheimer's and dementia research at NIH is now $3.1 billion. So we are talking real money. Next, the priority is to improve access to quality healthcare services. Advocacy volunteers across the country are engaging members in Congress to enhance and advance policies to improve access to quality healthcare services for individuals living with Alzheimer's disease. The healthcare system as it exists today all too often fails both those living with dementia and their caregivers. Because the Alzheimer's Association advocacy efforts addressing the shortcomings through better policies is now front and center on Capitol Hill and in federal agencies. And finally, ensuring support services for all affected by dementia. So more than 5 million Americans are now living with Alzheimer's, and another 16 million friends and family are supporting them. A complex disease living with and caring for someone with Alzheimer's has unique challenges, and it is why the association supports legislation that can have a meaningful impact to provide support system to all affected by Alzheimer's. I want to now share a video to show you the advocacy successes in Congress over the last 10 years. Okay, so now let me turn to the state policies. The association has 4 state policy priorities. The first is to increase public awareness and early detection and timely diagnosis. State officials must work to educate healthcare providers and the public about the importance of early detection and diagnosis, and to improve access to and awareness of resources such as the Medicare annual wellness visit. Through public health campaigns and data collection via the Behavioral Risk Factor Surveillance System, BRFSS, state governments can further address dementia in Arizona. Next, our goal is to build a dementia-capable workforce. State governments need to implement policies that will create incentives and career paths to recruit and retain healthcare professionals, require competency-based dementia training for all involved in the delivery of healthcare, and requiring training of adult protective service workers and law enforcement about how to recognize and interact with individuals living with dementia. Next, we want to increase access to home and community-based services. State governments can reduce long-term costs and increase access to person-centered care in home and community settings, including respite and adult daycare, regardless of age or financial status, through Medicaid and other state-supported programs. And finally, our priority is to enhance the quality of care in residential settings. It is important that state governments have in place laws to protect people with dementia from improper displacement in residential settings. State governments must also increase Medicaid reimbursement rates to reflect the higher cost of care for individuals living with Alzheimer's and other dementias to ensure residential care settings remain accessible to the populations and their needs. Thank you. Let me turn it now back to Lauren.
Thank you so much, Janice. Now we have Jackie Goodwin to share with you the different volunteer advocacy roles that the association offers. Jackie Goodwin became involved with the Alzheimer's Association in memory of her mother. She is a volunteer Alzheimer's ambassador, Alzheimer's state champion, co-chairs the bi-monthly Arizona Advocates meetings, and is a member of the Regional Leadership Council.
Thank you, Lauren. Thank you, everyone. Hello, and thank you for being here today. There's so much that we can do with advocates. We build relationships with our elected officials and their staff so we can raise their awareness of Alzheimer's and other types of dementia. We ask them to support increased funding for Alzheimer's research and legislation that will help protect and improve the quality of life for those impacted by Alzheimer's and other dementia. And one of the most important things we can do is to tell our story. As an advocate, you can choose to focus on state priorities or federal priorities or both. There are 3 advocate roles: Alzheimer's ambassador, Alzheimer's congressional team member, and Alzheimer's state champion. Ambassadors are assigned to a member of Congress, and they lead a team of volunteer advocates. As ambassadors, we arrange to meet with our member of Congress or their staff several times a year. We also continue to reach out in a variety of ways throughout the year. And in a moment, Laura is going to talk about the different types of advocacy activities. Alzheimer's congressional team members are advocates who are part of a team that works with the ambassador assigned to their member of Congress. Everyone brings different strengths, areas of interest, and expertise to the team. So it's a case of finding which type of advocacy activities you're comfortable with and you enjoy doing. Then there's the Alzheimer's state champion. These are advocates who are assigned to state legislators for their district. As state champions, we stay in touch and meet with our state legislators during the year. And of course, we have State Day annually, which is what we'll be doing next week and what we're learning about today. So there are many ways to be involved in advocacy. You'll have lots of support from James and all of your fellow advocates along the way, so I hope you'll join us. Thank you again, and I hope you enjoy your first State Day. Lauren, back to you.
Thank you, Jackie. Now Laura Vitkus will discuss the different advocacy activities the association engages in. Laura Vitkus is a community health educator from Tucson and has been volunteering for the Alzheimer's Association for 2 years. She has served as community educator, walk planning committee, and advocate. She is currently the Alzheimer's ambassador for Senator Mark Kelly.
Thank you very much, Lauren. So advocates perform a wide variety of actions in the various roles that Jackie just mentioned. We attend Alzheimer's Association events in any capacity that we are able to, whether you're just spreading the word about them or attending them or like serving on the walk committee. Mostly we advocate to advance public policy priorities that, like what Janice just covered, and we raise awareness. There are advocate planned events like town halls and coffee with Congress that are scheduled and set up by the advocates themselves. And then there's also the legislator planned events like coffee and town hall and community events that the legislators plan and that we as advocates can attend and help spread the word on. The legislative meetings that we do before COVID, they looked like we could just stop by. You could have drop-in visits with the office or schedule office visits to help keep the legislators apprised of what was going on with the association. We also post a lot on social media via Twitter, Facebook, Instagram, LinkedIn, or just simply sending a text to the legislator themselves. We respond to calls to action that come through the Alzheimer's Impact Movement, or AIM, and that often just involves clicking a button and an email will be sent to your legislator that you're signed up with. We also can do simple things like writing letters to the editors and op-eds or participating in TV and newspaper interviews if that's something that the advocate is comfortable doing. We attend State Day. We're all super excited about State Day. It's kind of, for me anyway, it's like the culmination of the year. Everybody gets together this year virtually, but it's super exciting and we just have a lot of fun, and it's a really great introduction to advocacy in general because you're meeting with the legislators of Arizona. We can attend Forum, which is an annual conference that is held out of Washington, D.C., but this year will be virtual, and so that will be exciting this year, but it's a great way for advocates to come together and learn what other people are doing and doing some networking and learn a little more about what advocacy is all about. And then personal messages are always helpful. You can send a message to any legislator that you want to. They're always open to communicating with the residents of Arizona and their districts. You can leave a message on the voicemail, you can send email. There's lots of different ways to have personal messages with your legislator that ultimately help build relationships with the members of Congress, state legislators, and their staff. So that's just most of the actions that we take as advocates. And back to you, Lauren, thanks.
Thank you, Laura. Next, to share with us some tips on how to best tell your story, we have Carol Brown. Carol is a member of the Alzheimer's Association Desert Southwest Chapter Regional Leadership Council, a member of the Public Policy and Advocacy Committee, a federal ambassador for District 4, a state champion for District 13, an Alzheimer's community educator, and the marketing and outreach coordinator for the Yuma Walk to End Alzheimer's.
Was extremely tidy. We were trained to put things back where we got them from. One day, when I walked into my mom's house, I felt like I walked to someone else's house. There was stuff everywhere, and just growing up the way I grew up, and to see this transition was very alarming. When Sean talked to me, it was a wake-up call, and that's when I went to the doctor.
Julie was always a voracious reader. She'd carry 2 novels on an airplane because she'd read one on a 3-4 hour ride. I'm sure it was gradual, but one day I noticed, there's no book at the bedside anymore. It got to the point, though, where it was taking her longer and longer to read a book, and at some point I began to notice that she'd read one page and have to go back because she couldn't remember what it is she had just read.
We realized this was something we had to talk about. I don't remember much these days after I read, but less does for me, and I love it.
Lauren, thank you so much for the introduction. I'm excited to be here. You guys have been hearing a lot of information that's really important and key to what we do as advocates. And I'm here to start the conversation about how to tell your story. And we refer to it by let's chat. So the first thing I want you to know, especially since if you're on this meeting today, you're a first timer being a state advocate and taking part, I want you to know that legislators are people. They're just like us. And as people, we're hardwired to learn through stories. So we want to make sure that we're not just reciting statistics, because that's not going to be enough to challenge possible preconceptions and misconceptions that legislators could have about this disease. So it takes our authentic stories from you and me, we're the constituents, to share those with our legislators. And that's the whole reason why we're here and why we want to be Alzheimer's advocates, right? We want to share our stories and we want to make an impact. We want to make a difference. So how do we do that? How do we share our own Alzheimer's story in a way that's brief, but compelling enough to support our legislative asks? So that's where we come in with remembering chat. We're going to make this super simple for you. So the first letter of chat is connect. And here are some suggestions for you to use so that you can find common ground when you're meeting with that legislator. So this is a great question to ask. And from experience, I've seen how powerful it is. Simply ask them, have you known somebody with Alzheimer's? Then give them a moment to tell their story. It's okay for there to be some dead air. Allow them to think and allow them to consider the question and respond to you. If they don't have a personal connection, they're probably going to acknowledge that they're very fortunate, but they likely know someone in their world that's been affected by this disease. So make sure you give them a chance to answer that question. After they do, then consider those shared interests in history that you could have with them. And that means, if possible, you want to do some research on how your story and the things you'll be asking for might relate to their background and their policy interests. So it will help to have some information on your legislator, but don't worry about it if you don't. Just keep going, because you're already working on that connection, aren't you? Want you to remember that all politics are local. So when you're speaking with a legislator, you want to highlight the statistics and the events that illustrate the impact on our communities, where you're from, where they're from, our state, because that's what they want to hear about. So this won't be the time necessarily for national information, but we want to talk about what's going on in our state of Arizona. And also remember, during this connect time, take the opportunity to say thank you. There's always a reason to thank your legislator. Let them know how much it means to you that they made time to meet. That alone says a lot to them. They get asked a lot of things day in and day out, and they have a lot of demands placed on them. So by us taking the time to recognize they're busy and they're concerned and we appreciate their time means a lot. Okay, next is the H in chat, which stands for hook. So what we're going to talk about here is how you can grab their attention by putting the legislators in your shoes. And this is the time for your story, but I want to encourage you, focus on a single story, okay? If you've been directly affected by Alzheimer's, you have a life that's been affected by it. And there could be many things, many aspects to your story. So focus on a single one, because you may only have a minute or two. Share that one moment of struggle or realization. You want to paint a picture. Remember, we learn through stories, and so telling the story, painting the picture is critical. You can use all 5 senses as you're doing this, and make sure you're using present tense to put them in the moment. So yes, the story could be in your past, but go ahead and share it with them as if it's current and how it affects you right now, because that's why you're an advocate. It's okay to get emotional. Listen, folks, I want you to know tears happen a lot, and they could happen with the legislator themselves. I've sat in meetings where tears flowed, and that's okay. And we just want to be compassionate and understanding towards their emotions, while we are also being getting emotional and sharing our story. And then allow that story to bridge the gap, to get you to the legislative ask. You want to highlight a statistic that's illustrating the broader impact of your experience. A lot of the information will be provided to you, and remember, it will be emailed to them also. So they will have the statistics and the information that will be referred to the legislative asks. All of that will be provided, okay? Next is the A in chat, that's ask. So this is the time for you to show them how they can help. And you want to ask that legislator for a commitment. That's okay, because that's the goal. It can be awkward and feel a little uncomfortable to ask them for something, to ask them to commit. Just remember why you're there and why this matters so much. It likely matters to them too. And so it's okay to make that ask for a commitment from them on the legislation that we are representing or supporting. If they need more information, that's fine. Don't try to bluff. Don't try to guess and make up an answer. Tell them, that's a great question, and I'm sorry, I don't have that answer right now, but I will find out the information and we will get back to you. Listen, that's a great opportunity to have a follow-up conversation with them. So don't discount the need to follow up with whatever information they may need. And define the next steps for the legislator. Ask what they need to reach a decision. And again, that allows you to make a plan for follow-up. If they have a particular question specific to the bill, and they need to know that before they'll commit, it's absolutely fine for you to say, I will get you that information and I will reach back out to you. And then if there's time, you can go ahead and share additional stories. This is that moment to kind of circle back around to the real life experience and the emotions that are involved with what we do regarding Alzheimer's advocacy. And then finally is the T in chat, and that stands for thank yous. Yes, again, we're gonna ask you to make sure you thank them for their time. Thank them for the meeting. Thank them for the opportunity for you to share your story with them, to hear their story, to talk about the legislation that matters so much to our state. Thank them for agreeing to support, for making the commitment. There's lots of ways to thank them at the very end. If we were in person, I promise you, this is where we would be taking pictures and hugging one another, because by now you've made a friend, and hopefully it's a friend for lifetime, but you've connected, you've presented that hook, you've asked for the commitment, and now you are thanking them for everything that they are going to do to help you be the best advocate you can be in the state of Arizona, and for our needs for all people that are dealing with a diagnosis of Alzheimer's or a form of dementia. So I'm excited for you guys. It's going to be a great time, and welcome aboard. And back to you, Lauren.
So at this time, I would like to ask if anyone has questions, please put them in the chat and we can go ahead and get those answered. Just give another minute or so. All right, well, I'm not seeing any come in, so James, we go ahead and hand it off to you. But if any come in, I will interrupt you.
Not a problem. Thank you, Lauren, and thank you to all of the advocacy volunteers for presenting. We are hoping to have an amazing virtual state day next Tuesday. Please don't forget that on this Thursday, February 25th, we will have a Know Before You Go seminar, which will go over our piece of legislation that we will be advocating for with legislators next week. And if you have any questions or interest in anything, please do not hesitate to reach out to myself. And I look forward to seeing everybody Thursday and especially next Tuesday. Thank you, everyone.
James, I think there was a question
Oh, okay.
in chat.
Yeah, so when will advocates receive specific legislative info for State Day? So that's what we will be going over on Thursday in the Know Before You Go seminar. So you're going to want to make sure that you tune into that to get a full briefing on the legislative ask that we are going to be advocating for.
We will be sending out all materials. Hopefully you can participate on Thursday, but you will have all of the materials before next Tuesday. Thursday we'll just be going over a brief detail. You'll get more information. We'll go into further detail on Tuesday, but this Thursday is an overview.
All right,
Perfect.
James, not seeing any more questions.
Well, thank you very much. We will either see you Thursday and Tuesday or just Thursday or next Tuesday, but thank you for stopping in and have an amazing day.
Thank you.